Mom Who Knows Nada. My name is Brianna, and this is the Mama Knows Nada podcast. I'm very excited to introduce a new guest to you today. This is Dr. Sara Sohn. She is a pelvic floor therapist as well as a sex therapist. So we're going to talk to her about all the things that keep women healthy post-baby, during pregnancy, that relate to the pelvic floor. And then we're going to talk a little bit about sex. We know that some people might get squeamish, but I'm super stoked to get her perspective on all of these things. So welcome, Dr. Sara Sohn.
Hello.
So pumped to have you.
Thank you. I'm really glad to be here.
Oh, it's going to be awesome. All right, so let's first talk about the pelvic floor. First of all, what is a pelvic floor? And then what does a pelvic floor therapist do?
I love that question. So real quick, so I want to touch on the pelvic floor therapist, but also just the terminology with sex counselor and sex therapist, because those are a little bit different too. So just remind me if I don't get to that point. But so your pelvic floor, I feel like most people like nowadays have a good idea of where it is, but maybe not like how big it is or just like how important it is and all of that kind of thing. So all genders have a pelvic floor, right? And so if you're watching in the video, I'm holding a pelvic floor model up to the camera.
Sexy.
And so, when you're looking at this, you're seeing basically like someone was laying down and you're seeing all the muscles that are between the legs. However, if someone was to stand, you can imagine that all those muscles are kind of like a bowl supporting all of the organs on top. So they're really important because like if you can imagine if you're like laying down and you touched your tailbone and then you touched your pubic bone, so the one all the way at the top and the front and then the one all the way in the back, that those muscles are wrapping all the way around there, you can start to imagine just how big of a span they take, right? So, and they go all the way to here to your like sits bones, the ones that you sit on. So, and then you can start to see how important it is for all the things that are around it, right? So, people think about the pelvic floor like and sex, and it's so funny because we sexualize those muscles, but then we don't really talk about sex with them. But at the same time, they have so many other functions too, and important for all these other things around it.
That's a really good point.
Yeah. Yeah. So I don't want to, I can go a little bit deeper into, what those muscles do and why they're important. But if you are interested in that.
Oh, yeah, go for it.
Okay. So when we think about the pelvic floor muscles, right, they are important for sexual function, but they're also really important for support of all of these organs here. So your bladder, they're supporting your bladder, your rectum. So we're going to live in a world right now where sex, bladder, vagina, vulva, rectum, anus, like all those words aren't scary. So someone's listening, they're like, we're just going to live in that world. Because this is this is real. This is our body, right? And so they're supporting all of those organs for continence. They're supporting they're really important for support for your hips and for your low back to prevent back pain, to carry your babies.
Amen to that.
So
that's what the pelvic floor does.
Yes.
Just so we're clear, people.
Exactly. And then
go ahead.
Well, I can jump into the second part of your question. So I'm Dr. Sara Sohn. I'm a pelvic floor physical therapist. So physical therapists in general, go to school and learn about all the muscles of your body and how to help recover after injury. And then to become a pelvic floor physical therapist, you specifically specialize in those muscles to help people with really intimate problems. So things like when people are peeing their pants or hurting down there, or to prevent those problems, right? That's what I'm a big advocate for. And Amen. In addition to that, I'm also a sex counselor. So the way that I kind of explain the difference. So for sex counseling, I help you to really enjoy eroticism, even if you've had some pelvic floor issues, to connect to that part of your body, to feel erotic, to feel embodied and safe, and to be able to explore your sexuality. Whereas a sex therapist would be, I kind of look at it as like from the past, which are really important things too. So things like helping people work through attachment and helping them work through maybe sex addiction or trauma or anything like that. So.
That's really important differentiation of like, and I also feel like, and correct me if I'm wrong here, that pelvic physical therapy can really help you inform people about any sexual issues that they might have or intimacy things, because you can really get into the details of, well, this is what this muscle does, and this is what this does, and this is how you have to manipulate or think about it this way. I feel like those are really, it's a like, you know, very compatible tandem expertise to have, you know, like how do you have one without the other? But I mean, I'm sure there's sex counselors out there who aren't pelvic floor therapists, but I feel like it's a really good, you know, launch pad for being really informed and really helping people connect with that, you know, personal side of themselves, which can be really scary to talk about. And we are going to talk about it, but not right now.
I'm actually really glad that you said that, because it's interesting. It's actually usually really separated. So it's I think I mentioned to you that my mom is actually an OB. Most OBs, most pelvic floor physical therapists, there aren't a lot of or any sex education requirements. So it's really interesting that you say that, because even in the medical world, they're often not talking about those things. And then when you go to somebody to talk about sex, they're not talking about the muscle part. So I really do love being able to put them together, branch them together.
Oh, I love that. I think it's fantastic. Well, when we talk about a pelvic floor, you've showed us all the muscles and stuff. What is a normal or healthy pelvic floor? How does that look like from your perspective?
Yeah. So I want to be careful with the word normal, right? And that quotes. Quotes normal. And then also what we're talking about in terms of the pelvic floor, right? So when you look down there, you know, you're seeing skin, you're seeing connective tissue, you're seeing, so a lot of times people will ask me, especially after having a baby, is my vulva normal, right? So, or my labia normal? Is all this stuff looking normal? Do I look completely different? And they're not always necessarily even talking about the muscles. And then with the muscles themselves, you know, we're looking at them just like any other muscle. There's this cool meme going around. It's kind of like, if you've had this injury, you do 6 weeks of physical therapy. If you've had this injury, you do the 6 weeks of physical therapy. If you have this injury, you see these different specialists. And if you've delivered a baby, in 6 weeks, you're fine. So it's like, right. Even though you literally had a baby sitting on top of your muscles for 9 months. And then depending on how you delivered, either had many supportive structures changed, you know, either surgery with a C-section or during a vaginal delivery. And so a lot of it is more really checking all of those things, right? It's not just the pelvic floor. So checking to make sure that, you know, all the supportive structures are strong, the low back, the hips, the abdomen, the pelvic floor itself, the skin and the fascia around there, making sure that it's healing well and showing different techniques if it's not, and ways to be able to move better. So that way you can, you know, take care of your baby without feeling all that pressure down there, or leaking urine when you sneeze, cough, or all those type of things.
What does a stereotypical appointment look like for a first time? Like if I was to walk into your office, what would that initial consultation kind of look like?
Yeah,
for you? So
in most countries, it's actually standard of care to see somebody like me 6 weeks after having a baby. So it's not, so right now, unfortunately, like the path to get to me, it's like either a mom was like, no, you need to do this, or their mom, right? It's usually their mom's like, no, you need to go and you need to do this. And so by the time that somebody gets to me, they're usually, like you said, like really anxious about what that experience is going to look like. And it's not scary at all. So once you're there, everybody says that to me. Oh, I was so worried. I was so, and then afterwards, like, this was so helpful. I feel like I understand my body better. So I think where you go is different. At least with me, I think that I feel very strongly that these are the really intimate discussions I don't like the medical model, so I started my own practice because I don't like people to feel rushed. So with me, a 2-hour postpartum visit or a visit postpartum is 2 hours. Actually, with anybody, it's 2 hours for the first visit. And we really get extensively into all of those different structures that I was talking about to check them, because nobody talks about pee, poop, and sex as much as me.
I love it.
It takes, a little bit of time just to warm up to be able to talk about those topics, and then, really checking all of those muscles and things. And then to get to the answer that I think that you're curious about is, like, how does the pelvic floor exam go? Is there stirrups or that kind of thing? It's usually it's when people they're like, oh, are you gonna have a light? It's not like that at all. For people, not everybody, for most people, like, if they're not comfortable with an internal vaginal exam, it's not something that has to happen, but because there's a lot we could see from the outside. But a pelvic floor exam with a pelvic floor physical therapist, it's just their finger. There's no metal, there's no stirrups, there's no, it's holistic in the sense that we don't write medication. So everything is an exercise or a lifestyle change. There's no injections anywhere, that kind of thing.
Good to know. I've never seen a pelvic floor therapist, so I don't know what to expect. And I feel like when someone's like, in your private parts, looking at you, it's always uncomfortable. I like that you mentioned, like, OBGYN and stirrups. Like, it feels invasive, anybody, most women, I think at this point, especially if you've had a baby, have been in the OBGYNs, or maybe you have a midwife, whatever your experience is, but somebody has probably looked at your vagina, and sometimes you're just like, oh, it's so, like, cold and sterile. So knowing that the environment's a little bit warmer and personal, and that you're kind of catering to people's different comfortability levels, because again, sex in our private parts, like, we don't talk about them. And I think it's really important for women, especially women who have had babies, but just women in general, to kind of own their sexuality and be okay with things that are uncomfortable, but also educate yourself about, what is this pelvic floor that we're now talking about? Oh, it's all these muscles in my lower region that hold up all my organs. Like, that's kind of important. Like, how many of us don't really think about that or even know that? Yeah. So let's talk a little bit about some misconceptions about the pelvic floor after birth. What should women be aware of in this postpartum period that, could be, I don't want to say abnormal, but, off, could be off kilter or, different than, pre-baby?
Yeah. So great question. A lot of people will tell me that they went to their OB exam and everything's fine. And what I really want to separate is when, someone is looking with a the speculum you were just talking about, they're actually moving the muscles in the video, muscles out of the way. And they're checking for disease, they're checking for healing at your cervix, they're checking to make sure that, to prevent cervical cancer. They're saving your life, your baby's life if needed. So there's a huge, that is like, I am so glad for amazing OBs, and especially this area. But they're not always considering the muscles. And even when they are, it's usually like, can you squeeze, right? It's not, there's a lot more that goes into checking for all those things. And so different things to look out for after, because people will brush them off as like, well, that's what happens when you have kids, right? So different things to look out for. And this is for anybody, because just because you don't deal with it then doesn't mean you don't still have it. I'll do postpartum visits with people that have had a kid, 10 years ago. It doesn't just magically go away, right? So things to look out for are, you're having to really cross your legs when you sneeze, when you laugh, when you cough. You feel like an ache down there after you're doing maybe childcare activities, vacuuming, or I'm making a lot of assumptions right there. That was pretty 1950s of me, but
we don't pass judgment.
Whatever it is that you're, doing, when you're going to, if you're, exercising, if you start to feel discomfort, and sometimes this stuff happened prior to even having the baby. Like, I didn't know that was what was going on, but difficulty having a bowel movement, feeling like, we're going to talk about poop, okay? The poop is stuck there and not exiting your body. There's so many different things, feeling an ache in your abdomen, pain with insertion, insertion of a tampon, feeling like a low back pain that you never had really before. Because what happens is when those muscles of that bowl aren't doing their job, other muscles take over. And so at the end of a long day of work, they might feel kind of achy, or like a pinch going from sitting to standing or rolling in bed. People feel like a pinch in their back, right at it's called your sacroiliac joint. And they'll feel like a sharp, pain that they kind of ignore for a while because they still have to hold their baby. Even, I'm really focused down there, but it's the whole body. So think about when you're breastfeeding, for example, or holding your baby and you're looking at their beautiful face for all the time. And now, if you were looking at this video, I'm looking down at my baby, and people start to get some neck pain just from all of this and carrying these bags that they were never carrying before on top of their baby.
Yes. That's a lot of crap. No pun intended. But yeah. I mean, because I think it's so important to just say that some of those things could actually be like day-to-day things. They might be something else, and we don't want to be like hypochondriacs here, but I would say, you're sitting there talking, and, I've always had sciatic pain, for example, and I was in hospitality for 20 years. I was always on my feet. So I attribute a lot of things to that. But at the same time, I've never seen a pelvic floor therapist. Maybe some of these things that, I have a pre-existing thing from, the type of work that I did, but perhaps things were exacerbated and I've just never checked them out because of what I was used to, because it's normal, quote unquote, for me. Like, that is my norm, is to feel that pain. How much of this is actually related to carrying a child, and from the 9 months until now having a 4-year-old, how much of am I impacted and not even realizing it, because we just brush it off as, we're busy. We're all busy, whether we're stay-at-home moms, whether we're moms with full-time jobs and taking care of our children, or whatever kind of hybrid that you have. It's easy to be like, I'll get to that. And then all of a sudden it's December and you're like, oh, it's Christmas time. I don't have time for anything. Or whatever you celebrate. I don't want to generalize here. It's the holiday season and you're busy. And then you go into the next year and you're not ready to go. So this is why I feel like this is so important to have this conversation, so that women can, first of all, I think it's important that we make time for ourselves and don't forget about our doctor's appointments. And I think that the more I get into talking to people and researching things, the more I realize I don't know. Hence the podcast, Mama Knows Nada. There's always something to learn. And I think we put so much emphasis on our OBGYNs having all this information, but they're trained in obstetrics and gynecology, not necessarily all the muscles in a rehab kind of thing. So I think, the more I dig into things, the more I realize specialists are my best friend. People who have an expertise, because how many pelvic floors have you seen in your life? I've only seen mine with a mirror. I completely agree that unfortunately, I think that's just a
overall, there isn't a big center on preventative care. So I think that's where the problem in lies, right? And so we wait until somebody has a prolapse, or we wait until somebody has all of these just things going on. But I'm so glad that there's people like you advocating for people to learn and be an advocate for themselves to prevent those things. And even, is it okay if I get a little technical about the back thing?
Go for it. Yeah.
So even, and this might be a little bit technical or like there, but
it's okay.
So every muscle in our body works because it's innervated by a nerve, right? So nerves go from our spine, then they travel, and then they go to different muscles. So, so when you think about,
I love these.
Sciatica. So some people use sciatica for other things, but let's just talk about specifically these nerves here for people that have like nerve pain down their leg, things like that. Those nerves, they leave here, so this area, and they actually travel through here. So if you can imagine, here are the glutes, and then if you take the glutes off, you have muscles underneath there. Those nerves actually travel from your spine. They go through those muscles, and on their way, they have branches that go to the pelvic floor muscles. So it's not like is one which is causing which. Either way, if someone's having sciatica, they are very, very likely also having pelvic floor things going on, because branches are what turn on and off that muscle, not to mention just walking differently, right? So if you're walking like this, or
the pregnant waddle, come on.
Yeah, the pregnant waddle.
I need swaying from side to side. Yeah, heard that.
I keep forgetting that I need to not everybody can see my like this face. But yeah, if you're walking with a limp or holding a baby and so you're off kilter a little bit, all of how that changes your pelvic floor. So just my little, I can't help myself aside.
No, I love that. I love that you said that, and you're showing that, it's all connected, whether the nerve hits that your sciatica, your neck, that nervous system, that spinal cord, all of those things are connected. I'm not good with biology and anatomy. That's not my thing, but I understand it very basically. And so I like that you point that out, because I think sometimes we forget. And, this is a caveat and like kind of off topic, but just for context, like I started playing tennis for the first time in like 20 years, like since high school. And I have noticed, just to kind of give something to parallel to for our listeners, is that I have this tight shoulder, you know what I mean? And if I'm not stretching out that muscle, all of the other muscles in this side are doing more work, and my neck's doing more work, and my back is doing more work. And then I'm pulling on all those nerves and all those other muscles to overcompensate for things that aren't as loose and fluid as they need to be. And I can feel that. And that triggers headaches for me. That triggers migraines for me, and a bunch of other things. So I think it's really important for us to remember everything is connected in our bodies. So you might think that you're doing yourself a service, but really you're just kind of, creating more of a problem. And so I kind of want to capitalize on that. Why is awareness and therapy important for this, in particular, this pelvic region of the body? Are there any like implications if it's not treated?
Yeah. So why is it important? Well, I don't know about you, but I don't want to pee my pants.
It's not comfortable.
Yeah, so I think it's important for your life, right? So it's important to prevent things like, leaking urine. I kind of akin that to like a leaky roof, right? So you might ignore it and you don't even know that you have a leaky roof, but then over time you really gotta work on the roof. So
yeah.
So
heard.
So I think just for overall life and comfort and confidence and ability to do the things that you want to do with your life, thinking about all of the different moms that I've treated, and every single one has said something to me along, I wish every single mom just had, like they say it in a rage, just like me, they're like, this should be a requirement. Every single mom should have this. Like they're so, just even awareness of your body, right? For some people, it's even once it's just the reassurance that everything's fine, that everything has healed well, and, they don't have to worry. Sometimes it's just that reassurance there.
It's important. Mm-hmm. No, that's important. 100%. Now you talked a little bit about poop. So can we kind of go into whether, like, can your bowels be impacted? Could you have some like incontinence issues or problems with, pooping?
Great question. So bowels impacted is actually like a medical term for a medical emergency. So just an FYI with the terminology, but can it be affected, by your bowels? 100%. So if we think of poop like a river, right? So like Willy Wonka's chocolate factory or something. Yeah.
Yeah. Good visual.
We got to make this a little bit, got to have fun here. So the river is flowing. The river could be flowing really quickly or really slowly. And those things are really commonly diagnosed and treated. That's when we change our lifestyle. We drink a little bit more water. We might take some medication to help, some fiber supplement, something like that. A rare things like what you were just bringing up, like about like an obstruction. There's basically somewhere in the river, the water stops flowing, right? And that's also really, it's really rare to have that, but it's really well treated. People find it pretty easily. And then at the end of the river, there could be like the exit, or the dam, right? And the gates aren't opening. They're not opening the way that they used to open. And so the water can get backed up there, right? So what happens there in your, might get a little technical here, but if the water can't exit, what happens, right? So your large intestine there actually is absorbing water, right? So then you start to get to this loop where stool can get kind of stuck there, and it feels almost like, this might get a little graphic, but a lot of your viewers probably have had to do this and didn't understand why. They'll have to push with their fingers between the for people that have a vagina, between the vagina and anus, they'll have to push there, and they'll insert their finger and have to, it's called splinting, push the stool out, things like that, because it gets like pocketed in that region. And it feels like it's just stuck at the exit. That's just one small example, but these are muscles that are completely, like here, if you're looking at the pelvic floor, the pelvic floor makes up the anus. Like, they're not separate muscles. Like they are, the external anal sphincter is part of the pelvic floor. So it's not like one is affecting the other. Like, that's what it is. you got to have somebody look at it.
Well, I love that you have your little diagram, your pelvic floor model. For anybody who's just listening, and it's pretty epic because you can kind of see like how it's all connected, because we don't see our bones and muscles internally.
Yeah.
When it comes to poop as well, could the pelvic floor, could it be like, could you have diarrhea from anything, that from like carrying a baby, or like could those muscles be like strained where things just come out too fast, to be graphic and weird?
So bowels are one of those things that it's complicated, right? There's so much that goes into that question, because it's affected by our food, by our hormones, think about the hormones that are changing, by our microbiome. It's affected by our movement. It's affected by our pelvic floor. So 100%, if somebody's experiencing a bowel change after delivery or even while they're pregnant, it can be related to many different factors, and pelvic floor can be one of them. That is often very common, but misdiagnosed. And so in terms of the way that it would look if somebody was having urgency is more what I think we're getting to there is they start to feel a lot of urgency to pee, and people don't talk about this, but a lot of urgency to have a bowel movement. Like, so maybe they're wanting to do a yoga class and they just can't hold back gas. That's usually where it starts, something like that. And they feel like they have to run to the bathroom. Those would be some indicators that things are starting to get urgent for them. And then, when you're talking about really right acute, so right after having a baby, I mean, that we could do a whole 5 podcasts on that alone, because that's, you know, time where everything is healing, and for most people, bowel movements can be uncomfortable, and there's a lot of learning there that can happen to make that time be as beautiful as possible and not as uncomfortable as possible.
Oh, I like that. I want to know. I'm curious. Like, it's all connected. So how does it work?
Can you imagine me at like what do you call, like a Christmas party? Because like everybody's curious, and I'm so like comfortable talking about these things that I forget sometimes. Like, it's like, can you pass the turkey? How's your poop? Like,
yeah, no, but you know, I love this conversation because there's so many things that I've wondered, and I never had anybody to talk to about it before. I'm like, is this normal? Is this not normal? Should I get that looked at? But I love also that how you're saying it could be, you know, that your muscles are, strained to some capacity, but there's all these other factors that go into it. And I think, again, everything's connected. Highlighting that it could be one of, you know, 10 different facets is really important. Like, if you're eating a lot of fiber, but you're having diarrhea, like, maybe you need to go get looked at, kind of thing, you know, just, you know, food for thought, keeping yourself informed, you know, and you know, we're in a society that we know a lot more than we did 50 years ago, even 30 years ago. So I think it's, you know, it can seem overwhelming, but the more information you have, the better you can keep yourself healthy. You can keep your family healthy. You can be present for your kids, and you don't not run to the bathroom every 20 minutes. Yeah. How does someone in your profession or like yourself really support, in particular, a postpartum body to regain, you know, a sense of, I'll say, equilibrium after baby? Yeah.
Well, I think in this conversation, it's really apparent why I advocate for one-on-one care. That's like, you know, my first appointment is 2 hours. So this stuff is complicated. And to create like that equilibrium in the body, I think it's really understanding the why. You know, taking the time. I think most people, not most people, but many practitioners are able to do that, but it's really just taking the time. So anybody that you're seeing, you know, really, you know, ask them why, and see if they're getting to that answer. So when I see somebody in those 2 hours, you know, sometimes it takes more than the first visit to really get to that why. And I'm honest with them. I'm like, this are the direct things that are causing this. These are the indirect things that could be attributing to this. And so then you can come up with a game plan that's unique to each individual to help them feel that equilibrium. And honestly, I just think it's time. It's taking that time to really break down all of those things. And that in itself is healing. Just to have somebody explain all those things and really understand the why behind the different way that you've been feeling, or even a feeling maybe ashamed to talk about.
Oh, I love that. And you kind of answered my next question, which is like, how do you support women? And what does a treatment plan look like? So I love that. Like, it's individual, kind of has to be. What my body went through probably isn't the same as like my sister. She had a C-section. I didn't. So what her treatment plan would be different, I'm assuming, because she had muscles cut open and in a child taken out of it, as opposed to me pushing out a child. I feel like there's probably a difference in that recovery plan.
Yeah, no, I would definitely say that there's no, you know, if there was like here's the 18 different steps that you can do in order, like, it just, then my job probably wouldn't be needed in that way. You know what I'm saying? Because it is so complicated. With that said, there are certain ways that sometimes I'll point people in direction of really great, you know, group programs and things like that for specific needs. But I think getting to the why of what's going on is the first most important step. And I do think that requires one-on-one, you know, looking.
No, absolutely. I would, you know, I can see why it'd be really specific, you know, like, we're all different. And, you know, even though we have the same organs and the same muscles and some people are just, you know, what's that thing, like your cervix can be like more forward or more back or things like that. It's like, just because we have the same organs doesn't mean we have the exact placement and the exact, you know, we're not carbon copies, you know? So it makes perfect sense that it would be, you know, what's what I'm looking for? a personalized plan for your pelvic floor therapy.
Yeah, but for somebody, you know, I think that the world is really improving in a lot of those ways. So there's some things it's like, you can you learn how to heal your pelvic floor on YouTube? Like, you know, you probably get a few steps there, you know, like, but it's interesting because there's research to support that more than half of people that think that they're doing pelvic floor exercises actually aren't. They're actually using, so, you know, and you see sometimes like those video, well, I don't know if you've seen this. My YouTube shows me some weird stuff, if you can imagine, but like those videos of people lifting up things like with their pelvic floor muscles, like, you know, they're often using their inner thigh muscles, your adductors. For anybody listening, it's like in the health or fitness, their glutes. You know, there's other muscles that take over those big ones. So I kind of attribute this to, like, if somebody's doing a pull-up, they could use their shoulders, their back, their biceps, or they could really hitch their legs forward and use their core, use their hips, right? So unless you're putting intention to use a specific muscle and you have learned how to do that, then it's really difficult to strengthen that muscle. You start to work on all the other ones around it. And anybody that's been to the gym to work out their legs and had sore arms afterwards can definitely relate to that experience.
Absolutely. Okay. So thank you for tuning into part 1 with Dr. Sara Sohn and learning how pelvic floor therapists such as herself can literally support your undercarriage's health. Interesting concept, right? Didn't know? You needed to know that. Tune in next time for part 2 when we delve into her role as a sex counselor. Feeling frisky?